Hello, everyone. A very good evening, everybody. I'm Priyanjali from Bladder Wellness team. I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic, renal calculi. Renal calculi or kidney stones are hard pebble like pieces of material that form in both of your kidneys when high levels of certain minerals are in our urine. Kidney stones vary in size and shape. They may be small as a grain of sand or as large as a pea. Rarely, some kidney stones are as big as golf balls. You have, if you have symptoms of kidney stones, including severe pain or bleeding, seek care right away. A doctor, such as a urologist, can treat any pain and prevent further problems such as urinary tract infection. To throw more light on the subject and guide us on what's right for diagnosis and treatment of renal calculi. Today we have with us renowned urologist Dr. Sarika Pandya. MBBS, MS, DNB Urology. She has a rich experience and hands on expertise in urology, female urology, and neurourology. Dr. Sarika Pandya has rich experience in the field of urology and carries out the renal calculi diagnosis and treatments with utmost precision and efficiency, ensuring that the patient health is in safe hands. A very good evening to you, doctor, and we welcome you to today's platform. Our first question, doctor, for you would be, what are kidney stones?
Kidney stones are the mineral materials, crystalline mineral materials that are formed inside the kidneys. That is called as a renal calculi. If it is passed off into the ureter, that it called as a ureteric calculi, or if it is formed into the bladder, then it's called as a bladder calculi.
Right. So, doctor, what are the usual symptoms of kidney stones?
Kidney stones usually they are asymptomatic if they are in the small size. If they are become the larger size, or they would drop off into the ureter and doing the obstruction of the urinary flow, then the symptoms starts. The symptoms usually are pain or blood in urine, or sometimes the patients feels that there is a difficulty in passing urine, fever with chills, vomiting. All these symptoms are because of the kidney stones.
Right. So, what causes this kidney stones?
Kidney stones can form into the body of the person because of the metabolism defect in the person, or some anatomical defect in the person's body. So if I or it becomes in the normal person who has a less intake of water in 24 hours routinely, or they have a high intake of animal proteins like non-vegetarian diet patients, or they are more taking of oxalate rich food, these patients have more chances of forming the kidney stones.
Right. So, doctor, why is it that we get to see such cases a lot these days? What has been the change in these few years?
Obviously the our lifestyle and dietary habits. Nowadays we are going more towards the junk foods, less more of non-vegetarian food, and as well we are taking less liquids, more of soda and by carbonated drinks. This all causes the formation of the stone formation, stone in patients very frequently. So that's why we are seeing these patients very frequently nowadays.
Right. So, doctor, that's what we are saying, that a basic lifestyle change can make a big change in as a whole,
Yes,
I believe.
right.
Right. So, moving on, doctor, quickly to the next question. Uh, do kidney stones form in one or both the kidneys?
It can form in both the kidneys, or it can be formed in the single kidney also. If it form mostly in the children or in the patients who have a metabolism defect in their body, they form stones in both the kidneys.
Right.
The recurrent
So,
stone formers also have the stones in the both the kidneys.
right, right. So yesterday itself, I was talking to a friend of mine, and she was facing the same issue. All of a sudden, the doctor mentioned that he might have a an occurrence of kidney stones. So there were a few tests which were prescribed. So doctor, is surgery the basic tension was, if surgery is required or not? So we are talking about the same point again. Is surgery required for all the cases or not?
No, not exactly. It depends on the stone size and where is the stone. If the small stones of 6 to 7 are into the kidney, we can wait for the surgeries. If the
Right.
stone is less than 4 size into the ureter, we can wait and observe the patient. If of the 4 to 6 size of the stone into the ureter, we can give medical management to these patients. So it's not like if you have a kidney stones or a stones in any of the urinary tract, you have to undergo for the surgery. So that is definitely patients are fearing of because of to come to the urologist that they will always suggest the surgery. It's not like that. We can help you without surgery also.
Right. Also, doctor, my father had suffered from kidney stone issues. When we were a child, we always used to hear that such issues they used to make a fuss out of it. But now, with time passing by, technology has advanced. We also get to hear that it's not painful. So, what are your points on that? Is the surgery painful or not?
No, nowadays the surgeries are so fine, and endourological surgeries are now like it's innovating in its own way. So it's definitely not painful. Definitely, we can help you with very minimal invasive surgeries like ESWL, mini perk for the renal calculi, or either retrograde intrarenal surgeries like RIRS, laser lithotripsy. These all are very minimal invasive surgeries, and patients recover immediately after the surgery. So it's not always a painful. Nowadays,
Right.
it's improved a lot.
Right. So today, doctor, we are talking about a very common issue. So when we are talking about the same thing, that patients are recovering very soon, we have also heard, basically there are a lot of myth, including kidney stones. A lot of people around us, they have a lot to say. Rather than going to the expert, they make up their own notion. We get to say that. We have also heard that once someone has a tendency, or once someone faces the occurrence of kidney stones, they have a tendency to have it again. So is it true somehow?
Yeah, in the patients who have the first time stone formers, it's very rare to get the second time. But if
Mm.
they get at least once in a lifetime, there are chances of 25% to get it again. But if they got the stone formation again 2 times or 3 times, then definitely 50% chances to get it again in their lifetime.
Right. Doctor, somehow is it hereditary as well?
Yeah, yeah. In some cases, it's a hereditary as well. Cystine stones are usually hereditary stones that occurs in the children of the parents, as well as the renal tubular acidosis is also a hereditary stone former. So it is a hereditary as well, but very we can say prevalence is less in stone formers with hereditary cause. Definitely, but it's a hereditary cause is also present.
Right. So people who are watching us right now, doctor, and they are wondering that my parents or my forefather or anyone from my family had been facing with the same issue. So what can be the precautionary advice for those people?
Yeah, my dear friends, I would like to suggest you certain precautionary advices for the prevention of the stone formation. First is intake of water, liquids, any kind of liquids, at least 2 to 2.5 liters in a day. Second is don't hold your pee more than 2 to 3 hours. Third thing is reduce the intake of animal proteins. That means non-vegetarian food. Don't bombard yourself with the non-vegetarian food morning, evening, afternoon like that. Once in a week or twice in a week is fine. Third thing, less the oxalate-rich food like uh, spinach, tomato, cauliflower, all these things has to be reduced in the patients who are a stone formers. not all the patients, not all the general population. And the people who are on had a history of stone in past, they have to do regular checkup with the urologist, and at least once in a year ultrasound, KUB, at least kidney, ureter and bladder, to see any stone formation is there or not. So we can recheck them with, if it is the stone is smaller in the size, and we can treat them with medical management also.
Right, right. Doctor, the first point itself was so important. And with the hustle and bustle, people tend to forget the basic things. May it be the lifestyle, the sleep cycle, the water intake, water being the main source of life. People have literally stopped taking water. So I've also heard people asking me, are there any alternatives of water? What do you have to say about that, doctor?
uh, we are thinking of alternative of water, that means it's alternative of life, because water intake is our life. We can't escape from taking a liquids. So I don't think any alternatives of taking of water. Yeah, definitely you can take liquids of any kind, either buttermilk juices, fruit juices and all you can add on. But definitely we can't come out from the taking of the water or liquid intake.
Right. Also, doctor, speaking about that, uh, as we know that water is very much important, also we know that sleep, having a proper sleep is also important. Does it has got anything to do with kidney stones?
Sleep, exactly, it's not related to the formation of the kidney stones, but definitely the patients who have the kidney stones in their body, they have altered sleeps, difficult sleeps, because of pain, because of strangury, because of the burning sensation in urine, or because of the burning sensation in genitourinary tract. So that all cause their altered sleep, but sleep causing the kidney stone formation is a myth.
What about stress, doctor?
Stress, stress can cause more of urinary complaints like dysuria, burning sensation, and as well as urinary frequency, urgency. Those of kind of symptoms are more with the stress, but not with the kidney stone formation.
Right. Uh, so, doctor, all of us watching this live right now would want to know this. How does the initial stage look like? What are the initial symptoms which one can face? Usually it becomes very hard to understand the disease initially, that what we are having. That is the main game of the entire deal. So how does the initial stage look like?
Initially, if the stone is small in size, they won't do any pain or anything. So sometimes the silent stones are also present in our body. So sometimes we find it accidentally, like we go for some other thing for a checking of to the other doctors, like general practitioner or a physician, in if they advise for the ultrasound or any x-rays, in that we found the stone. So those are called the accidental stone form, kidney stones. So there are accidental kidney stone diagnosis is also there. Second thing, the most common is the flank pain. Flank pain is not exactly the back pain which is in the middle of the back, but it is on the both the sides of the back, both the sides of the spine. So that is called flank pain. Third thing is sometimes patients see blood in urine. Fourth thing, they find that blood, burning sensation while passing urine. They find that their flow is not good. Urine flow is coming as slow, or it's coming in very drops or like that. So these are the we can say the local symptoms. The other are the systemic symptoms, like patient who are in sepsis or they have an infection, obstruction, they have a fever with chills, they have vomiting, continuous vomiting. They have a high grade fever. So this kind and their pulse rate are raised. They are looking very sick. So it depends on the where the stone and how is the obstruction.
Right.
So these
Doctor,
are the symptoms.
right. Also, doctor, we know that from one disease, it's normally the usual case. From one disease, there is an occurrence to another disease. So, can kidney stone be the reason of any other diseases occurring?
Yeah, definitely. Kidney stone formers, if they have a recurrent stone formations, they have a shrunken kidneys. Some kidneys goes into non-functioning kidney also. Their kidneys are becoming non-functioning, and they have to undergo the removal of the kidney because of the stone, long-standing stones, and the kidneys are not working. Or those patients go undergo into the chronic kidney diseases, and their creatinine raised. They have to undergo for the dialysis. They have to go for the kidney transplant. So there are multiple diseases which lead because of the kidney stones.
Right,
Even some patients with the bladder stone also, they goes into the retention of the urine. They could not pass even a drop of the urine. So there are they have these are the common problems I am telling. Some are the problems because of the stones are into the genitourinary system. That means their ureter become narrow. Even after removal of the stones, it not increasing in the size. They required a further treatment for those kind of the problems, ureteric stricture. So there are multiple diseases can occur because of the kidney stones.
right. Well, the entire picture is very scary. And the only solution to it is to not prolong it. Our experts are always there around you to help you out with the best solution. Consult the expert. Doctor, I can see our audience interacting with us. We have the first question coming from Sai Sudeep, who asks, do children get kidney stones? If it is, what are the precautioners? What are the precaution advice?
Yeah, definitely. Children get kidney stones, and if I'm not mistaking, this Sai Sudeep is my patient with the child who we operated with the kidney stones. I'm not sure, but looks like that only. Yeah, they definitely get the kidney stones, and in children, the kidney stones are mainly because of the metabolic dysfunction or anatomical dysfunction in their genitourinary tract. So, if once we diagnose that they have a kidney stones, they should be in regular follow-up with the urologist, because in their lifetime they are definitely getting again the kidney stones. The parents should be very provoked and come to the urologist with the kid regularly. They should have regular they should, after removal of the stone, undergo a 24 hours urinary examination to find out what substance is more in their body and which is causing the formation of the stones. So pediatric patients are our most priority for with the stones.
Right. Doctor, the next question comes from Divya, who asks, Ma'am, I want to know what is the role of diet in preventing kidney stones?
Yeah, as I told you previously also, the diet is definitely have a role in preventing the kidney stones. The increase of liquid intake, avoiding the oxalate rich food, avoiding the non-vegetarian diet, avoiding the carbonated drinks, soda and all. These all are helping us to preventing the stone formation, as well as to increase the liquid intake is really helping to have a preventing the stone formation.
Right. Also, doctor, I don't think so. It will be the right question to ask you, but then I would definitely want you to throw some light into it. We have also heard about few home remedies for kidney stones. I've seen people plucking leaves, making a juice out of it, and drinking, thinking that the kidney stones would wash away. Any home remedies which you would suggest for kidney stones?
Here in Telangana and AP, people are more favorite drink for them is the barley water. I don't know how it helps, but they think that because of the barley water, we will not get the stones or the stones will come out. But the home remedy for the kidney stones is drinking of lots of liquids. No other remedies will help you. That's the final dictum for today's
Right.
show.
Right. Well, water would not just save you from kidney stones, but a lot of diseases. We can assure you that. Quickly, doctor, moving on to the next question. Rahul Bastar asks, what should I seek? When should I seek medical attention for kidney stones?
If you know that you have a kidney stones, at least visit once to your urologist. Whatever the size of the stone, they will guide you what to do for those stones. If it is obstructing your urinary system, definitely you may require some medication or you may require some surgery to prevent further damage to your kidney. If you are asymptomatic, they will guide you what to do for that. So at least if you know you have a kidney stone, just consult once to your urologist. That is my advice.
Right, right. Doctor, we are talking about a healthy lifestyle. We are talking about a healthy diet. Um, Also, everyday exercise, somewhere it is involved in a healthy lifestyle. Do we suggest, regular exercise to the patients who are suffering from kidney stones or to the patients who have just been through the diagnosis?
Yeah, definitely. Because the obesity is also a cause of formation of the kidney stones. So definitely exercise helps for the coming out from the obesity. Decreasing the weight also helps to preventing the recurrence of the stone formation. So definitely exercise is a part of body, as well as once the patient get the diagnosis of the stone, their stress level becomes so high. Not even only the patient, it's a whole family become stressed out. So exercise definitely help to reduce the stress level also. So there is no question about it.
Right. Doctor, the next question comes from A. Raju, who asks, can kidney stones cause complications?
Yeah, as I always as I mentioned previously also, kidney stones can cause complications in the view of to the kidney damage, in the view of causing the chronic kidney disease, in the view of causing the damage to the genitourinary system itself. Like it causes the stricture of the ureter, it can causes the infundibular narrowing of the kidney, that is the part of the kidney becoming just one part becoming narrow, and those part becomes the without function, or whole kidney becomes without the function, or it will cause the infection to the kidney that can cause the systemic symptoms with fever, chills, increased counts and all. Or it can cause long standing kidney stones can cause even hypertension also. So there are multiple complications of the kidney stones.
Right. The next question, doctor, is from Navodeep, who asks, are there different types of kidney stones?
Yeah, there are multiple types of kidney stones. Kidney stones are calcium containing stones, they are uric acid stones, they are infection stones, they are cystine stones, they are medication related stones like uh, anti HIV drugs like Indinavir also can cause the stones. So there are multiple variety of the stones.
Right. You have already mentioned the next question was quite similar. Sarthak asks, can certain medications contribute to kidney stone formation?
Yeah, yeah, yeah. As I told you, the anti-retroviral drug, anti-HIV drug like Indinavir, or the drug for the trimethoprim that is used for the hypertension, these drugs can cause the kidney stone formation.
Right. Also, doctor, a question out of the context. We we get to see, we are talking about the lifestyle, we are talking about the people, how we are so much keen towards work nowadays, we tend to forget everything. Our sleep, we are sleep deprived, we are food deprived. But there are also a certain amount of crowd who are very much conscious. They are health conscious. We get to see young children nowadays making six packs, and they just like having a good body. But what is inside the body, we never know. They tend to take certain levels of steroids or proteins, which is not required, which is not prescribed by the doctor. We know that there is a particular amount of protein for every body type. But again, having a good body, and we forget everything what we should take. So are those steroids and proteins, can those be anyhow, harmful to our health?
Steroids increases the weight first of all. So obesity, as I mentioned earlier, also can cause the stone formation. Second thing, steroids, long term steroids can increase the blood glucose level. So the patients with the kidney stones and obstruction somewhere with raised blood glucose, like diabetic patients, they have very immediately complications of the kidney stones infection and sepsis. So these are not a direct way, but indirect way, definitely it will harm the body of the patient, of the person with high steroid levels, as well as same as with the proteins. Because of the in the race of making six packs and all, we are forgetting our routine food, our basic food, Indian food, and we are following the more of western countries, as well as more of animal proteins, non-vegetarian diet nowadays. So these all non-vegetarian food had a more high level of the uric acid. So uric acid stone formation is more common in this kind of the persons. So this way also it affects the person's life also, and stone formation. So indirectly as well as directly, both the way it affects the kidney stone formation.
Right. Doctor, you mentioned about diabetes. Please let us know how complicated it gets for a diabetic patient to,
It is very much complicated, and sometimes very much scary situation also for the diabetic patients to having a stone for a, we can say, which is obstructing their urinary flow. It's not that the if the patient having a kidney stone in one kidney, that urine flow completely stop because of their other kidney is functioning well, the urine formation will be there, but the stagnation of urine on that kidney makes the whole scenario very worst. They goes into sepsis very frequently, very early, very soon. They recover very slowly. And if the obstruction is not relieved soon, they will go into kidney failure also. They may require dialysis. They have to just put it sometimes stent. If stent is not going, that is, stent is one kind of wire we are using to put to bypass the obstruction through endoscopy. But sometimes what happened, because of the long standing stones, the stent is not going. So in such a situation, we have to put a tube outside from the body, from the back of the body of the person, to remove all the infected urine to come out. So a person has to move around for a few days or few months with this tube. So these all things happens to the diabetic patients. So for the diabetic patients, if they feel little discomfort in their urinary system or they feel pain, they should immediately consult to urologist.
Right, right. Well, we are talking about few of the most basic and important things today in this life. We have with us Dr. Sarika Pandya, and it is a very, very informative session which we are carrying on so far. The next question, Doctor, comes from Abhishek Sen, who asks, when should I seek medical attention for kidney stones? Again, the same question.
Same question. Yeah. Abhishek ji, I would like to say, if you know that in your body there is a stone, or you feel any urinary symptoms like burning sensation or blood in urine or pain or any symptoms, you just consult once your urologist. They will do certain tests and find out that the stone, is there a stone present or not. first of all. Second thing, if they find a stone, they will tell you where is the stone, size of the stone, and that stone requires any treatment or not. If the stone requires treatment, then which kind of treatment? Just a medicine or any surgery is required? Surgery is required, then which kind of surgery is required, that also they will tell you. So whenever you feel any discomfort in you, in your urinary tract, or pain or anything, or even you have a suspect that I may have a stone, definitely visit to your urologist.
Right. Doctor, now we are going to talk about another myth, which we don't know how true it is so far. We have heard that having beer can lessen the possibility of kidney stones, or in case if you are having kidney stone, it can just wash it away. What are your points on that?
Sorry, Priyanjali, I did not get your question. I was in some other mind. Yeah, can you repeat it once for
Okay,
me?
okay. So we have also heard that intaking beer can, lessen the possibility of having kidney stones, or in case if you are having kidney stone, it can just wash away. What are your points on that?
Yeah, beer with friends is always a welcome drink, but not regular based. And the kidney stones to come out with beer is, it's really myth. It's not. It's a beer is what one kind of liquid only. So it is not like that. It will wash out your stone. So it should be in moderate amount, and some occasionally only, but not on the name of the kidney stones.
Right. So, doctor, as other diseases, is alcohol somehow, okay for kidney stones? Do we let the patients take that?
Uh, I would like to tell you that the alcohol can, how it affect the genitourinary system, means urinary tract. Alcohol increases, it's a diuresis, so it increases the urine output. In simple term, it increases the urine formation. So if you have a stone which is obstructing in one of your kidney or both of the kidney, and you are taking excessive alcohol, what it will do, it will increase the urine formation. Already your kidney is blocked and you are increasing the alcohol intake, it will make more pressure on your kidney. So it's not okay that you should have alcohol along with the kidney stone disease.
Right. Doctor, is smoking harmful as well for kidney stones?
There are no data as such case smoking will do harmful to the kidney stones, but definitely it will affect on your recovery post surgery. If you require a surgery, your recovery after the surgery is definitely affect because of the smoking, because your lungs are always compromised even after smoking of 1 or 2 packs in a day. So definitely it should be a red flag to have a smoking also.
Right. Well, we had a very, very informative session today. And for all the viewers who are still watching us right now, we have talked very basic. We have talked about the most important things about kidney stones. And before we leave, doctor, any take home note for the viewers who has watched us so far?
Yeah, my dear friends, I would like definitely suggest you to have good enough liquids in a day, 24 hours. The at least 2 to 2.5 liters. But it's not for all that they have to take a 2.5 liters of liquids. It depends on your working place. It depends on your atmosphere where you are staying in 24 hours. So that is the first thing, you should have nice liquid intake. Second thing, your diet, you must be careful on your diet. Third thing, if you have little suspect that you have a stone in your body, in your kidneys, or you have any symptoms related to kidney stones, go and meet your urologist immediately. Don't wait for to it become more worse, and don't hesitate to undergo for the surgery if required, because sometimes it helps you to save your kidneys also, or save your body also. So definitely you should consult your urologist. Those are my humble requests to you, my friends. If you have any queries or any questions, you are open to ask me.
Well, uh, that was Dr. Sarika Pandya for us. Thank you so much, Doctor, once again for your valuable time. It has been quite an informative session for all our viewers today, and we'll look forward to many more such sessions in the coming time. And thank you, you viewers, for your excellent participation. For more information, update, stay connected on our FB page, Bladder Wellness. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a great evening.